Good morning. Thank you very much, Professor Medina. First of all, I'd like to thank my co-worker, Dottoressa Daniela Baccarini. Most of the work in this paper was done by her. So nowadays, we are living a new interest for vitro-retina interface. This is secondary to new machine, for example, advantage in OCT and image processing. In the improvement of vitrectomy machines, in the visualization, in few words, we can treat better these patients. Moreover, the vitro-retinal interface has been identified like a site of many different pathologies, like, for example, in some kind of macroedema, in some type of macular degeneration or vascularization secondary to vascular problems in the retinal vessels. And for this reason, the vitro-retinal interface is a target today of surgery of a few cases, unfortunately few cases, of some pharmacological agents. And we are assisting a continuous evolution of this machine. For example, from wide field spectral domain CT to web source to intraoperative CT, for the use of CT during our surgery. To the last, for example, this is an image of M-phase optical coherence tomography. To arrive to the last machine, for example, adaptive optics. This is a typical case of adaptive optics in epiretinal membranes. To arrive to angio OCT. And up to now, the angio OCT is used only for retinal vessels problems, like macular degeneration, some kind of big macular edema. For the first time, we observe the use, the utility of this machine, of this exam in problems of vitreoretinal surgeries or problems of vitreoretinal interface. You know that OCT angiography has the great advantage to study the dip at the superficial vasculature of the retina, compared, for example, with photoangiography. And we observe some cases of our patient operated on for epiretinal membranes, for full macular thickness macular hole, for lamellar macular hole, and for pseudo hole. And for the first time, we observe also the functional aspect of these problems, comparing, associating the microperimetry with angiography. We use this machine, you know very well this machine. This machine has the advantage, at least in our surgery, to have an eye tracker system and to use a new software. This new software is essentially to see the better where is the side you are examining, where is the side you have operate. This, for example, the SLO image enables accurate location and positioning of the raster eye scan. And you can see the same in the preoperative period and posterior surgery. And this is advantage to use, for example, tracing IHD. You see the different definition. You use this machine with eye tracker instead of without eye tracker. Of course, what you gain with the eye tracker, you lose in definition of in the time of precision of the exam. And you can have also three different scan area, starting from 3x3, of course with very high definition, arriving to 9x9. But you can have also a reconstruction of this area. You see these are 9 square of a 3x3 high definition exam. This was a typical pseudo hole. So let's start with comparison between the LTI and the epiretinal membrane eye. You see these LTIs? This is the epiretinal membrane eyes. You see the distortion of the lamella of the superficial, a deep layer of the retinal vessels. This is the full thickness macular hole. You see this typical aspect in phase of CT, the absence of the signal in the area of the hole, the cystic area in the internal nuclear layer. There are similar cystic area in angio CT. You see the peak of the absence of the signal secondary to the window effect of the absence secondary to the absence of the neuroretinal tissue. This is the difference with the lamellar macular hole. You see that, of course, the peak effect is less because, of course, you have remnants of neuroretinal tissue at the bottom of the hole. You see the difference with the hole. And it's complete difference with the hole. Complete absence of the peak of the signal, normal configuration of the superficial and deep layer, because of course the thickness of the retina is normal in this one. And we associate for the first time the functional aspect of this problem with AngioCT. We use this machine. This machine is very easy to use. It's very fast to take exams. It's using the new software. It is your software allows us to integrate with other devices, like example, invasive OCT and angiography OCT. This is, for example, a OCT angiography and of epiretinal membrane. See the distortion of the superficial layer and deep layer of the retinal vessels. It is the normal sensitivity of the epiretinal layer of the macula of the patient, at least in the first time before the surgery. This was the full thickness macula hole, the cystic space around the hole in the M-phase OCT, of course, and also in the angiography OCT. This is the absolute sense of the sensitivity, a very deep scotoma in the central part, but it's very, very strange that the scotoma is extended also in the area where the cystic space were. You see the scotoma is larger than the area of the macular hole. This you see in another case. You see this the deep layer of AngioCT. This is the microperimeter. You see the scotoma is extended very, very far from the area of the absence of the neuroretinal tissue. The scotoma is extended up to the area of the microcystic space in the internal nuclear layer. This is another case. What's about the lamellar macular hole? Of course, the behavior of lamellar macular hole is completely different. You see this, the typical aspect of macular hole, a peak of the signal is less than complete macular hole. And this is the microperimetry. You see a relative scotoma surrounded of perigonal ring or relative scotoma. You see this difference is no very deep scotoma like macular hole. So, but we follow the patient after the surgery. You see after the surgery, you see this aspect of B-scan OCT, and this is the aspect of the AngioCT. You see the complete restoration of the distortion of the vessel. And you see this area of lack of perfusion of the vessels. If this area is decreasing during the follow-up, arriving to the little bit normal area 4 months after the surgery. This is the full thickness macular hole. This was 1 week after partial vitrectomy. You see the absence of the peak of the signal before the surgery. You see the complete restoration after 4 months follow-up. You see also the area of the cystic space around the macula, around the macular hole. You see the restoration of the normal aspect after 4 months of the surgery. And the same for lamellar macular hole. The same. See, this area is disappearing during the period of the follow-up. This was a particular case. It was a retina detachment secondary to myopic macular hole. You see, it was a detached retina, very crispy retina. The internal part of the retina was very, very rolled. It was a macular hole. It was a detached retina. This was the AngioCT. You see the absence of the functional test in the center of the macular hole. Also the very low sensitivity around in the area of the retina detached. You see after the surgery, 1 month follow-up, complete restoration, not only anatomical but also functional. You see the bubble of the gas after 1 month of follow-up. The hole was completely closed, and also the sensitivity was completely restored. So why we are doing all this exam? Because up to now we are performing ophthalmological examination. We are performing OCT we examine thickness of CT, we examine the AZ zone, the ellipsoid zone, and the integrity of the photoreceptors. Maybe today we have to add to this exam the AngioCT, because also in surgery it's very important to have some more parameters to give the patient more information about the prognosis of the problems. And of course, also some functional exam, very important, like microperimetry. In conclusion, OCT could give new insight, also in particular field like the problem of the vitreoretinal interface before the surgery. In addition, provide new novel biomarkers of surgical outcome, because you have to say to your patient the possibility, the prognosis of their problem. Maybe the overlap of microperimeter, functional exam with aspect of anatomical perfusion of the vessel of the retina is a unique functional structural vascular integrated test. Thank you very much for your attention.